So we have Taurus here with us today. He's from Georgia, all the way down in Texas now. So he comes with us with middle and upper back pain, shooting pain into the left side, some numbness and tingling, some low back pain. That also shoots into the left side, and some neck pain. And the pain in his low back was so bad that he already got an MRI, right? And he has MRI scheduled for his upper back and neck, and that's mostly due because he has shooting pain going down. If you have something that's on a nerve, these usually can manifest as shooting and numbness and tingling. Okay, so he has that going on, and he also goes to a chiropractor almost weekly in Georgia, and it does give him relief, but he still has these issues. So he's here with us today to see if we can help him. Okay, yeah, so we're going to start the treatment. So you can go face down. And we've already done the examination, so we're jumping into the treatment here. And if you can look at his right leg, see, it's short. See, I can put my thumbs here. Look at that. You can see it's short. It's very short. Okay, so the first thing we're going to do, we're going to try to make his legs even. Well, how do you do that? Well, where do the legs go? They go here. So him having a short leg just tells me his pelvis, his low back is twisted. So with a wedge, we're going to figure out how it's twisted. Okay, let's see. Okay, come here and see this. See, I can put two thumbs here. Now look, they're even. Okay? So when I put a wedge here, it evens out. So what does that mean? You think if I put a wedge here right now, it'll be even? Or it's going to be uneven? It's going to be uneven. Can't twist both ways, so let's see. So this should make his twist worse. So let's see. Look. Because he's already twisted that way, and putting the wedge under just makes his twist worse. So he's already twisted this way. Putting the wedge here even makes it worse. So the way we fix him, we're going to put the wedge here. We're going to recheck it's even. Okay, so now we know how he's twisted. That's the way we're going to fix it. So if you go to a chiropractor and just cracking you everywhere without even testing it, well, what are they doing? You got to know how to fix it. Okay, so we're going to fix it correctly. So this side had come back, so I'm pushing it forward. That's what we're doing. And there's a wedge here, so the wedge is also acting, the SOT block it's called. So I'm pushing here, the wedge is pushing it up, so that's what's happening. Okay, let's see if that made any difference. Okay, come look at it now. Even, but there's no wedge there. So he's even without the wedge now, so we took the twist out. You think if his pelvis isn't twisted anymore, you think that's going to help the twist in his low back and his upper back and his neck? Yes, it's going to help him. If he's not falling to the right side anymore and he's straight, is that going to help him? Sure is. Okay, so we're gonna continue now. These are going to be painful. Okay, you ready for this? Sure. So we're going to loosen up this L5 here. We're going to push it straight down. Good. I'm going to open up the sacrum. Wow. I felt that one, man. I'm going to push this down a little bit up. This is going to be a little bit sore. This is the one that stuck the most for you. There you go. Okay, good. Yeah, it's all stuck. So we're going to loosen all this up before we do the ring dinger, okay? So you ready? Sure. There we go. Good. Okay, I want you to scoot down. A little bit more. Thank you. Okay, you're going to feel the chest piece pop up. Just like that. Okay, we're going to first push here. Oop. Now we're going to push this a little bit forward. Okay, good. I want you to now flip and go on your back. Okay, let's come a little bit lower. Open your hands. Okay, put the hands back. So what we're going to do here, we're going to pull his leg. It's going to open up his hip and even do, I guess, a mini ring dinger on his low back, okay? So you've seen this video, right? You know how it goes? Okay. Okay, loosen that up. There you go. Oh, wow. Okay. There we go. I heard all those. Okay, have a seat. Face that way. Good. So when you first came in here, your blood pressure was really high, right?
Oh, yeah.
Yeah, really, really high. But that's very normal because people have seen the videos, they know what's going to happen. But after he was seated for a while, we took the blood pressure again and it was 20 points lower. So it is, when you see the videos, it's very nerve-wracking. Okay, so now we're going to do the ring dinger. Okay. So you've seen that, right? So on your back, head here, and legs on this side. Okay. So a lot of people don't know why this leg piece is going up. It's going up because what we're doing is we're flattening the curve of the back. So the curve has a back. When the legs go up, it kind of flattens. We're doing that because when I pull his neck, pull his entire spine, this force is going to go all the way through his spine. So if it's flat, the force goes in easier. So we get more release. So he's a bigger guy, so this comes higher. If you're a smaller person, it goes lower. So it all depends on your height. So that's why it's adjustable. Okay, so we're gonna have you come down a little bit more. That's perfect. Okay, so now he needs a little bit higher. Good. That's parallel. Okay, so this is a wet towel. People don't realize that from the videos. And it's wet, so it has a better grip on the skin. So you seem very quiet, so what are you're taking it all in?
Oh, yeah.
Okay, good. So the pins is the worst part of it. You probably heard that from the videos a lot, right? Mm-hmm. So it has to get very tight in there, okay? There we go. Now put your hands here. Don't bite your tongue. Breathe through your nose. And just try to relax. Good job, man.
Wow.
Good job.
Oh, my God.
Keep breathing. That's wow. Yep. Keep breathing. There you go, man. Still kicking. Good. No screams. I'm impressed. No screams. So what did you feel, man?
Oh, better.
Did you feel your spine stretch all the way down? Mm-hmm. It's hard to describe it. Okay, so hard part's done, man. Just some neck cracks. And we're going to do on the lower neck for him. Right there. Okay. All the way, a little bit more. Good. Relax a little bit more. A little bit more. There we go. You breathing? You okay?
Yeah.
All right.
You're fine.
Good. Okay, let me help you up from the side. Okay, now stand right there. Close your eyes, look all the way down, all the way back to me. So like, on the top, there you go. And then forward. Okay, and then look neutral, just straight forward and open your eyes. Okay, so let's take a look again. Almost even. I would say your left side's a little bit lower. Not too much head carriage. That's impressive. Usually people have a lot of head carriage. He only has a little bit going on. Okay, relax those, yeah. Neck's still a little bit even tilted to the left side, I would say. Hips look good. So what we're gonna do, we're gonna hit you with the gun, okay? You're in Dallas, so we gotta use the guns. Okay, so all back and then bend. There you go. Okay, good. Now look all the way down. I'm gonna push on your head when I do this. Okay, and all the way back. Okay, now do the same thing. Close your eyes, look all the way down, all the way back to me, and then center. And then open up your eyes. Your neck should feel a little bit looser when I did that. Mm-hmm. Okay. All right, so let's do this. Let's have you walk to the mirror and come back, and then we're going to ask to see how you're doing, how you feel. His first ring dinger, and I've been seeing it for years.
I feel lighter.
You feel, yeah, that's what patients usually tell me. Okay, so how's everything feeling right now?
Much better.
Much better. Okay, so you had that shooting pain, especially in your upper back, lower neck. How does that feel right now?
Like I won.
Okay.
Yeah.
Okay. So do you still have neck pain, back pain, upper back pain, or lower back pain? Did any of them get resolved right now?
Right now? No.
Okay. So when you came in, though, you did have some pain, right? Mm-hmm. So just for the people watching, so his upper back pain was a 4. His shooting pain on the left side was a 5. His low back was a 3. Shooting pain on his left side was a 3. His neck pain was a 2. So you don't have any pain right now?
No, right now. No.
Okay. Was that successful, you think?
Yeah.
Okay. So you can have a seat there. I'm going to tell you what we did. So remember, for the people watching too, his right leg was short like this. So if you can show the people the right leg. So I'm exaggerating it right now, okay? So his right leg was short when I put it together. So what happens when you're standing? Well, you fall to the right side because it's short. What does your body do? It pulls you back up. You can't be crooked like this. Your eyes aren't level with the ground. You're going to get dizzy. So the body does everything it can to pull you back up. So for some people, it manipulates here. It brings this more up. For some people, the neck. So right now, we took the twist out of his hips and his feet evened out. It happens every single time. Okay? His feet evened out. So now he's straight for the first time in God knows how long.
Months.
Years. No. Years. So that pain you're having in your low back and neck, it's probably because you've been like this for years and just manifested it. Okay? So we made you straight, and then we did the ring dinger and pulled you all the way open. So you can expect good stuff. Good things are going to happen. Okay? So what do you have for the people watching? Do you think they should come get this treatment? Or?
Oh, yeah.
Yeah, and you've had other chiropractic treatment.
Yes.
Okay, how do you compare that to the normal chiropractic?
Much better.
Much better. Yeah. Well, thanks for sharing this to people. This is just for educational purposes, guys, okay? So I'm Dr. Ali Elahi from Advanced Chiropractic of Dallas. See you soon.